listeners, welcome to Connect with Christina, and today we have Dr. David Campbell with Maple Leaf Chiropractic.
That's correct.
What up, Doc? How are you?
I am good. How are you?
You're always good. Doc, how long have you been in practice?
Long time now. I'm getting old. I am officially at 26 years as of this August.
And did you always know you were going to do chiropractic?
No, I had no idea, actually. Started off getting a degree in human biology and, just realized that this one kind of fit the paradigm of the types of things I had learned already. So I went to chiropractic college, and the great thing was the beginning of it was kind of like a review of the things I'd already learned. So I just became better at those things, made it easier to understand anatomy, physiology, and then, chiropractic school just gave me the necessary tools to be able to bring all that together.
And would you say it's been a rewarding career for you?
Yeah, we play a game at my house called Peach and Pit. Have you done that before?
No.
Basically, the idea is that you discuss, what's the peach of your day and what was the pit of your day, just to kind of push it out of the way. And
I
everybody
like
takes
that.
a turn. Yeah, you should try it.
Everyone should do this.
Yeah, so on more than one occasion, my wife and daughter are always like, yeah, we know what your peach is, you enjoy your job, and it's really fun, and I do. There's always pieces of a job that you don't like, my paperwork is like, hate that word, right? But, it's a necessary evil sometimes.
Right.
But the rest of it, no, I don't have a problem with interacting, communicating, people expressing how they can help themselves if they so choose. And, it's been fun.
Well, and I think those little, you called it pits, what makes us appreciate the peach.
Correct.
So it's like needed.
Yeah.
In your office, do you accept insurance or just cash, or what's the dynamics in there?
We're a mix. So for the most part, a large portion of what we do is personal injury, more than half. And then there's just a mix of like Medicare. I also I'm a provider for the VA. So if people need care, and they qualify for it, they can come see me. So those are the two that we really accept as in-network providers. However, all the other ones we're pretty much out of network for. So
being a VA provider, is that a specific qualification that you have to go through?
You just have to apply, and be accepted and stuff like that. It's not that hard to do, but, it's just a paperwork thing. But once it's done, then it's a simple renewal going forward. But then you get direct referrals from the VA, maybe they can't see a person right away. And they have their own doctors and physicians on staff, but sometimes it's restrictive from a distance, so they send them to me. And it's called the CCN, the Community Care Network. So that's kind of outside of their...
Or call Christina now.
Or we could be that too. Look at that. See? Man, well done. I like that.
But that's good. I didn't know that, the whole VA thing. So we'll definitely share that. I had no idea.
Yeah, it's very useful for them because it does provide care. And they have no out-of-pocket expense, and allows them to get massage and therapies as well as chiropractic all at the same time, right? So we can kind of bring it all together in one place. So it works out well.
Okay, and then with your car accident situations that you've dealt with, I'll just ask a simple question. When a car gets hit, right, and then when people come to you and they're hurt, in your experience, like what are some of the common injuries you've seen, and why do you think it's that way?
You have to look at kind of like the mechanics of the individual, right, because there's a lot of factors that can increase an injury or reduce an injury. So, for example, if a woman is smaller framed and shorter, right, the seat, is not necessarily designed for that size of a person. So then they can become more injured. If you're aware of the impending injury, right,
and you're tightening
and you brace for it, right, you'll probably feel more like in your wrists and your shoulders and your feet or knee. Compared to somebody that doesn't know that it's coming in, they're just kind of limp at the time. It's probably more like spinal then, right? But in the end, pretty much in an accident, anything goes, right? Depending on the direction at which you were hit, the position of you at the time of impact, right? How big or small you are, how strong are you? Do you go to the gym? Do you not go to the gym? Do you eat every meal through a drive-through? Right? These are factors, right? Because you already have pre-existing inflammation. And then we take a person and, they get smacked and you tear stuff, right? A great analogy that was given to me is the idea of like silly putty, right? Where you can slowly stretch out silly putty, but if you take it and snap it real quick, it breaks apart. And this is what's happening, in your body when you get hit in a car accident, all these soft tissues, because the argument is always, hey, that's just soft tissue injuries. Well, last time I checked, nerves are soft tissue, right? So your irritating nerves, ligaments that are stability in nature are now being damaged, and that's a problem going forward, even though they kind of minimize, the effect of some of these low impact crashes, right? It's upsetting, quite honestly, because people suffer as a result.
Correct. And a lot of them just try to deal with it on their own because they don't know their rights even.
Correct.
A lot of times people that are in accidents, the first thing they think of is, oh my gosh, I don't have money for a lawyer. I don't have money for a chiropractor. And they don't know that it's the only area of practice of law where you don't have a retainer.
Yeah.
As a matter of fact, you can go see the doctor. You can get help. But take me back to like the car aspect. So when the impact happens, right? So does the car take the initial like impact and then that it travels through the person, or how does that work?
Yeah, nowadays what you have is, they've added more, I guess you could say, safety features to a vehicle to try to help. But at the same time, what it's doing is it's minimizing the amount of what we call ride down. So it's not crumpling as well because the shock absorption effect of the bumper is now transmitting through the vehicle and into the human, right? And it's so instantaneous. That's the problem because, your head can be sitting there and, most of us, we have a phone now that we look at all day. So our posture is not as good as it could be. And so it's not like we're sitting there to stop with our head against the headrest waiting for the potential rear end accident to occur.
Right.
We're doing whatever we're doing. And so then as a result, that happens so fast that all that, velocity goes through that human. And we're not designed to have that sudden snap, right? And so, like I said, depending on the position of the person, anything goes. And if you're driving a pickup truck, and not like we don't have a lot of pickup trucks here in Arizona.
Especially.
It's like, oh, good. If it's not a Tesla, it's like a Ford F-150 that I see on the road, right?
That's true.
They're rigid. Right? They're meant to be more rigid from a frame standpoint. So small accidents can cause that much more problem to the individual that's driving it, especially if they come with like pre-existing stuff, like over the age of 50, some degenerative stuff in their spine already, right? And now we've just, whacked it out real hard. They're like, I was doing just fine until this happened. And now I have, pain radiating down my legs, all sorts of different symptoms, so it's crazy.
Talk about whiplash.
Whiplash from a standpoint of a rear end kind of whiplash is probably the worst one that you can get. Because in most cases, unless you hear the screech and look, you might not even see it coming. And so then as a result, the movement is such that your whole body goes forward and you're strapped in, hopefully, with your seatbelt on, but your head stayed where it was. Right? And so then eventually once the vehicle stops, then your body stops moving and then your head comes forward. So it's like a hyperextension followed by a hyperflexion movement, right? So the potential to tear ligaments front and back, is definitely a possibility, at least on a microscopic level. It may not be completely ruptured. But as a result, right away, you're going to have pain probably within the first 3 days. There's going to be stiffness, lack of movement, headaches, all sorts of potential symptoms into the arms because of the inflammation that's being formed around the nerve roots. And so as a result, that's when you really have to start to assess this stuff at the beginning rather than waiting to see if it's going to go away, right? Because that's not a good idea, and like we talked about insurance companies, they have a tendency to they kind of dangle that carrot in front of a person within the first week. Hey, like we'll give you $1,500 and you can go to the doctor for a little while. You got a month to do that. How's that sound? And people grab at it, not understanding that, hey, in a month or 2 or 3 months from now, I might have headaches every day. I might have
Correct.
difficulty lifting a coffee cup, right? So doing that's premature. Right? So always making sure that, you get someone to talk to that can, and we'll say CCN, call Christina now, from a standpoint of just understanding what your rights are and what you should do and take your time with it and make sure that you are 100% back to the way you were before the accident. For sure.
Right. Well, in all seriousness, I always tell people, whether we're able to help or not, please hire a lawyer, hire someone. We just want you to get help, obviously,
Correct.
But I wanted you to go over like the spine makeup, like, what's around our spine, and like, just because I know I don't think about it. I mean, I definitely have zero knowledge about anything medical. I don't fall in the usual Filipino world where it's like medical. I know nothing. So what's our spine made of around, and why, how come like a lot of the people in the car accidents are just like have devastating injuries?
Yeah, so like I was describing with regards to like a rear impact type of injury, the musculature, if you're not ready for it, right, is going to go through a sudden movement, just like the ligaments can be injured. Most likely you're going to have tearing of muscles, right? And so around the spine itself, you have all these muscles that, help with movement, but there's also ones that are like more like stabilizers, right? And that's just like holding your head on top of, your neck and shoulders. And if you don't have that stability anymore, then after an accident, invariably people discuss, my head feels heavy, because they've torn and injured some of those postural muscles. And it's just difficult to hold it up, right? As well as the other ones that are for movement and, and mobility, these ones will also become injured, right? And if you look at the ligaments that hold this individual spine pieces together, now we can have trauma to them, right? And that's going to create even more instability. And that's why it's essential, in the beginning stages to get really good, x-rays, radiographs of movement in all directions. So, it's a little more, I guess, complicated than it is where someone just says, I sit at a desk all day, and I have neck pain. It's like, no, we got to take more images of you to make sure that everything is in good shape and that we're not
missing anything.
Yeah, you're not missing the potential like a vertebral instability as a result of the accident, right? So that's key.
Yeah, and none of us understand any of that. And that's why when people are, they're just like, all they know is that they're in pain.
Yeah.
So what parts of the back do you see are most affected, or that it just comes back to depending on how the impact happened?
Like if everybody had a perfectly healthy spine, and they got rear-ended at, say, 15 miles an hour, almost all the time you'll see some sort of loss of the normal curvature in the person's neck, right? Now they can have that beforehand, but let's just go with the idea that they're optimal when they get hit. So right away, they usually have a straightening of the normal curvature in the neck, or it'll even reverse, right? And if left unchecked or fixed or corrected, it will continue to manifest itself and create problems. Obviously, in the low back, because of the seatbelt and across your waist, we can get a shearing effect, and so the lowest part of the lumbar spine can also be affected. So the disc there, we increase the chance of herniations, bulges, protrusions, that will just increase the potential for pain radiating down the legs or loss of other functions, that most people want to have, right?
And what happens to people when they don't address these issues? Like, our bodies are miraculous. I always say they'll heal, but if they heal the wrong way. So from a doctor's perspective, what can happen?
Yeah, that's a good question. The idea is that, just leaving it alone is not enough, right? Especially if some of these things have been compromised to that degree. You want to be aware of what's in you internally, because it could help you make decisions about what you're not going to do, right? So, for example, we know an individual now has, after an accident, a serious disc injury to his low back, and he has pain, but, he hasn't lost any other function. Well, I wouldn't want him going and doing 2 rounds of golf over a weekend, or, like he never goes bowling and now he's going to go and, bowl 4 games with his buddies, right? Like, it's not a good idea, at least in the short term, right? We got to make sure that, that you're back to your normal situation of, I'm not as in much pain, I'm stronger, I have the flexibility that I need to do this stuff. So these are the types of things, that you have to kind of identify in an individual at the beginning, so you can give them some limitations, even if it is only short term.
Doc, what, in your opinion, or I guess in your experience, can happen to someone's level of injury when it's a slow impact? Like, what's the, I don't know, can you get hurt at 5 miles an hour?
Definitely, no question about it, right? Once again, depending on, the situation of the position that you're in, what kind of car you have, what kind of vehicle you're hit with. Basically, the idea of if the vehicle, the bullet vehicle that hits them is over 500 pounds heavier than the other one, then it doesn't really matter, like what the weight of your car is or the speed and stuff. It's just, it's mass, right? And it's coming in at a greater amount, right? And yeah, granted, if you even just add like 2 or 3 more miles of speed, then it becomes even more of an issue where, the amount of energy that has gone through this human, right, while they sit there unaware of what's happening at an extremely short period of time is going to be devastating to the soft tissues of their body, no question about it. So, poo-pooing and saying that, 5 miles an hour, how could you possibly get injured? Don't kid yourself. You can get injured from it. And I felt it personally, right? I had someone back out of a parking spot while I had my foot on the brake and, leaning on the horn. And within 3 days, like my hip hurt where I was holding it on the brake and I was getting headaches from it, like she just backed into me out of a parking spot, like if going 5 miles an hour. So yes, can you? Definitely.
Well, there you go. You heard that here first. And that's a sensitive subject because people always say, or at least insurance companies try to say, you can't possibly get hurt. So thank you for answering that.
That's right.
And you personally had patients that have gone through that?
Oh, yeah, definitely.
On top of you experiencing it.
Yeah, you see the damage, and there doesn't seem to be any rhyme or reason to the way the insurance company will respond. So here's a person with $1,100 worth of damage, and it's mostly like the bumper, right? But then I'll have another person where they have $14,000 worth of damage, and what they say? Well, this is a really nice car and it has a lot of sensors, so they treat it like it's the little bumper one, right? Just because it's a Mercedes. You see what I mean? And so it doesn't really matter.
Things to think about.
Yeah, that's how they approach it. Unfortunately, like I said, they always try to get to the person before they have any representation or any knowledge of what their rights are, and they really take advantage of that. Some of them are worse than others, but it happens all the time. It's a shame.
Well, and going back to the property damage, you mentioned it could just be 1,100, but unless it's getting looked at by a reputable company, you don't know because you got to check the frame. You've got to check the wiring, the computer system,
The thing that I always tell people, hopefully they listen, is did you get pictures of the other car? Because, they'll get pictures of their car.
There you go.
Because that's what they're concerned about. But sometimes, the picture of your car is not as bad as their car.
Correct.
Right? And that just helps you understand, okay, yeah, they nailed my Expedition right on the trailer hitch, right? Look what their car looks like. My car's not bad. Yeah, but, maybe the frame, a little bent, right? But it's stiffer, right? Because it's basically a pickup truck, and all that force went through that lady driving her Escalade, right? That's a problem.
That totally makes sense. So. And on the doctor's perspective, what's the first steps that a car accident victim should take? Well,
I always say, you should go to the emergency room. I wouldn't go to an urgent care per se, because a lot of times that's where people go, and there's imaging is limited, if that, right? They usually send you away with anti-inflammatories and stuff, and that's the same for the hospital. They look at it as a soft tissue injury. Maybe they'll do a CT or some imaging, but never an MRI. That is rare, right? And so then as a result, the person leaves, and they have some muscle relaxers and some anti-inflammatories, and they might feel better to a certain degree, but they're just masking over the symptoms of what's going on. So that's the first thing, just to document it, because it's always helpful to say, here we have a medical doctor, that has done that. If they don't go there, then that's always a good step to start with. If they come to me, depending on their symptoms, it might be immediately to imaging, or it might even go as far as a neurosurgeon consult, because they're that bad, right? Especially if I see instability on those x-rays, because I do that in-house, right? So I can do all that right away, look at them instantaneously and go, yeah, we got something else that we need to do before I can do anything for you.
Well, it's good too that you've been doing this for a while, because I'm telling you, people don't know what to do.
Yeah, I bet. They're confused, and they're already upset because, if they've lost their car and maybe they're, underwater on it, and they don't have everything that they need, and they're concerned about how am I going to get to work, all those kind of stuff. And this is where the dangling of the carrot, comes into play, right? It's like, I'm going to be off work for a week. What do I do?
Right.
I need money.
Yeah, and it's really like a profound, experience that can not just be traumatizing, but we talk about that all the time. It's like so many levels that that people go through when they're in an accident. It's not just physical; it's emotional. It's all the things. Doc, to the patients and clients who are like, "I'm fine, I'm fine, I'm fine." Do you still suggest that they get looked at in case that they are just not feeling their injuries?
Yeah, that's the way to start, just so that they understand that, if they ignore this in the short term, then when you try to come back later, you're adding information for the insurance company to deny taking care of you only because there was a gap in treatment, right? It's key that they would look at it from a standpoint, which is kind of ridiculous in the sense that, hey, it could take a couple of weeks where you get back to doing what you normally do and it's starting to really hurt. But they look at it as like, well, you couldn't have been that hurt or you would have gone right away, So that's the argument that they make. So, yes, we want to make sure that people are treated quickly. And if they're fine, they're fine.
If they're fine, they're fine.
That's fine.
But the problem is that when you didn't go, it's too late.
Yeah.
Right? That's
Correct.
really the biggest thing. And I just want to empower people to know their rights, to put themselves first and take action because help is out there.
Yeah. The one of the things that I tell most of my patients, and like I said, I'm a mix of this, like non-insurance versus, PI. And so I tell the non-insurance people, hey, you can come here whenever you want. But the PI people, it's like, listen, someone else is paying for this. It's important that you follow a schedule. They want to see a treatment plan from start to finish. And you can't just kind of come and go whenever you want because they look at it like, well, you're utilizing the service whenever you feel like it. No,
you must not really be her.
Correct.
Right.
So
don't miss your appointments.
Yeah, or make them up, whatever it needs to be, like just follow through with what is suggested. I've done this long enough to know that I have a pretty good idea based on looking at an individual and what their lifestyle is, what it's going to take, right? Can we get to that point? Or is it going to be quick? Is it going to take longer? So it's not that hard anymore. It becomes predictable, I guess you could say, once you have more of the facts, and that's where I love pictures, having pictures of what happened to them, having pictures of whatever on their body is bruised or airbag burned or whatever. Even though I'm not necessarily doing anything for that treatment, just to have it, right, and to be able to present it, it's worth a lot, right? The whole picture worth 1,000 words.
Especially with bruising because it changes colors.
Yeah.
Sometimes they don't know they have it. Like, especially with kids, they'd feel bad. Like, oh my gosh, I had no idea my kids had all these bruising from the seatbelt.
Yeah.
So check your kids too.
Yeah, make sure, and it doesn't always pop up right away. It can be delayed a few days, like spraining an ankle.
Yeah. I have something else to bring up to you. I have one of my closest cousins and my uncle, my cousin in Vegas and my uncle in California. So they're deathly afraid of chiropractors.
Yeah.
Okay, I go quite regularly. I need it. Yeah. But they're afraid, and because TikTok keeps showing them, and I think once you watch one, it'll keep feeding it to you. But they keep sending me videos of people getting paralyzed from chiropractors.
Is that a TikTok?
Yes.
I have to look those ones up.
Yeah, but so to her, so I can show her this video, like, how do I explain to her that obviously you want to find a good chiropractor?
Yeah.
But relating, being paralyzed from a chiropractic care is just, what do you think about it?
Well, first of all, like, why are people videotaping those particular ones? When you think of how many chiropractic adjustments are being done, right? They talk about, like a problem like that happening. I think they said once every, when the bean counters do this stuff, once every, say, like 37 chiropractic careers, and, that can vary from different problems. The idea is to find one that you're comfortable with. What level of treatment do you want to receive, People always ask me, well, what kind of technique do you use? It's a big question all the time. And I always respond, it's like, listen, not everything works. One thing works for everybody. So I have to have more than one way of addressing a person. Because if I don't, right, then, they may not be satisfied with the treatment they receive. So you have some people that just want really low force, gentle things, and they get a benefit from it. Then you got the other people, it's like, hey, like, if you don't do like those TikTok videos to me, then I don't feel like I get anything out of it. So you see what I mean? Right? So there's like a
They
scale.
were saying that it's just the scale of the impact is what can paralyze someone.
But you have to look at it from a standpoint of the movements that are on those TikTok videos. What are they geared for? They're geared for views, right? And that's what gets views, right? Like a guy sitting there and like lightly pushing on somebody is not going to get, more views. If I just sat there, I'm gently touching their atlas and making sure that it's in the line. Like that's not going to get it, right? And unfortunately, that's just the case. It's like shock and awe, right? It's what drives people to see it.
Right. So it comes down to just to business for some people to show that and like instill fear just for views.
Yeah. Knowing full well that guy that's doing those videos is also doing, so many others that, aren't probably as aggressive or as loud. It's like they're handpicking the individuals that, hey, you look good in tights and you make a lot of noise when I adjust you. Isn't that great, right? So when you start to look at them, you realize, that's what they're kind of gearing it towards, right? And that's great. If anything, it may not necessarily, it'll freak some people out, but I think it pulls more people in to question, how can this help me? What type of problem do I have? And really, when it comes down to it, most of the things I'm trying to fix on people come down to a movement deficiency, right? Something is not right. And so I'm introducing movement, hopefully in the right direction, so that they feel better, the body heals itself. I don't do all that, right? You innately have this intelligence in your body that will fix it, right? I don't have to tell my body to scab over and fix a cut, and reorganize the tissues. It just does it, right? And the same thing applies here. I'm just introducing a force, and sometimes it's more forceful than other times. But like gearing it towards the individual is important, right? What can they tolerate? What do they need? What do they not need, right? And sometimes some of those videos probably look like, where the person, they look like they're being broken in half, right?
Right. And I think you're right. They're going for that noise.
Correct.
But I know we're coming to an end here, but I have a couple more questions. So in your own words, what really is chiropractic care?
Chiropractic to me is taking an individual and trying to optimize them towards whatever their requirement is, right? I don't try to push anything on people. I have my own mindset of what I want and what I want them to do, but I don't push it on people. I know that for the most part, people want to get out of pain first. Usually that's how they're coming to a chiropractor. But as time goes by, then they start to understand that kind of wellness or holistic aspect of, it's like changing the oil in the car. Why wait until it's smoking to do something about it, right?
That's a good
preventative, right? And we are on that side of things, on the preventative side eventually. Are we good in these kind of crisis situations, especially with people that are in a lot of pain that's musculoskeletal in nature? Yeah, definitely. There's no question about it.
So what other benefits do chiropractic care offer that's on the more holistic side and preventative? What other things is it for?
No, that's a good question. So, outside of, treating the injuries and stuff, optimizing the person, like I've had individuals tell me where they knew that they needed to come to see me, not because they started to have pain, but because they started to have acid reflux. And if they waited long enough, then they would actually have back pain. Then they would come, they would get adjusted, right? And then, of course, the pain goes away, and guess what else goes away? The acid reflux.
Wow.
Right? So, like your whole spine, not only does it, go to muscles and and things of that nature, but it also goes to organs, right? So it's like a map. It's pretty easy to see, which organs will be affected by what area, and so these other symptoms can come about, and no one makes the relationship between there could be something wrong with my, nervous system. It's irritated in some way to the point that it can create a symptom in an organ. And people don't think of it that way. They can get the idea of a nerve being irritated and be numb, tingly, pain, muscle weakness, that kind of thing. But, suppose I, irritate the nervous system as it exits your upper back. Well, guess what? That goes to your heart and your lungs. So you have difficulty breathing, people have stuff in their neck where I'm like, do you ever have a hard time swallowing fast? And I'm like, oh yeah, I just recently, I'm having a hard time, taking a full gulp, with feeling like I'm getting caught up. So all these weird little things that you don't make the relationship with.
So for an average person, right? And I'm always thinking about servers, people that are in the service industry, even other professions like a massage therapist. They're giving so much of themselves to us. A bartender that's always standing up, a barber, a nail person's always leaning. Like those people, what would you recommend that they do for chiropractic to take care of themselves, because they take care of all of us?
Yeah, like looking at what their workstation is and, what kind of ergonomics they're dealing with, that usually determines the way that, I would take care of them, helping them understand, what's your habits with regards to standing all the time, are you really good with adjusting, the barber's chair to make sure, that you're not holding your arm up. So, I've had my share of those individuals over time, making sure they have sensible shoes with, maybe like orthotics in their shoes because, their feet are bad already, these types of things which help make sure that, the whole chain up into the back and the shoulders is balanced, because it really comes down to balance, right? If you're imbalanced from one side to the other and you're standing all day, you're going to notice it, whether it's like in your knee or your hip or your back, like almost right away with enough time. Yeah, that's what you're going to experience. So, coming to a chiropractor, getting evaluated, seeing what might be going on and trying to eliminate, those structural things just optimizes you, gets you better right away.
So is that why you even have like specific sandals at your clinic? What does that do?
The reason that I have that is because for years, I was harping on people with regards to their shoe wear, right? It's like, you're not helping me, right? You're wearing like $3 ones that you got from someplace. And so they're like, well, it's too hot here. I don't want to wear shoes. I don't want to put orthotics on my shoes or anything like that. So then that's why I started looking at, okay, I need an alternative for them. Hey, you can get some here. Here's a couple other, brands online that I really like.
The ones you gave me were very comfortable.
Yeah. They're not expensive, and it just helps people understand what it feels like to actually have a reasonable support when you're walking around on pretty much like concrete and tile all day. Like that's what we have out here, right? Nobody has basements. We have wood floors underneath us, like that would help, but It doesn't, right? So.
And then lastly, on the pillows that special places like chiropractic clinics offer, what's a big deal about those pillows?
So every car accident victim that comes to see me, I give them a pillow. And primarily because a large majority of them have had like a rear impact collision, they have that whiplash issue. And so as a result, we're trying to support them while they're sleeping and hopefully in a better position so they don't have like a really flat pillow or this big, huge, fluffy pillow. It's almost like their spine's in an alignment position while they're sleeping so that we get, some uninterrupted time for the body to heal and try to minimize the stress that came as a result of, the impact. Now, they could just have crappy posture, right? And then they could also benefit from that too because maybe they use too big pillows and they lay on their side and their neck is bent all day, or, the worst is like the stomach sleeper because, you have to turn your head in some position to be comfortable. That will make it difficult.
I'm laughing because I'm definitely a stomach sleeper.
Yeah,
but what's the best way to sleep then? I hear you're not supposed to stay on your left side because you're putting pressure on your heart. Like, what is it?
I tell people, hey, side, if I sleep on my right side, so that's me, but
so you're leaning on your heart on the right, right?
No. When you're on your right side, then your left heart, for most people.
Oh yeah, what am I saying?
It's okay, right? But then obviously on your back as well is good. Stomach is just, can you get into a position that's good stomach wise? Yeah, like suppose you had a massage table where you could put your head straight in there and then like put something underneath your legs and your hips maybe. Yeah, and you could lay there. But, invariably you're going to lay like this, so that you can get your head into a position where you're breathing. So that's like saying, hey, can I have your head turned like this for 8 hours and then try to come back to here? It's going to be uncomfortable, right?
Justin, how do you sleep?
Left side.
Left side. So on your heart.
Uh-huh.
So you're saying the best position is on your back or the right side?
Yeah, like optimally, like I wouldn't give him a hard time about sitting on his sleeping on his left. Like if that's the comfortable position for him, that's a comfortable position.
I swear I saw somewhere that you're not supposed to go on your left because you're putting pressure on your heart.
Well, yeah, because everything's kind of draining in that direction. But like if your heart's working properly, I can't see why it wouldn't. If you're
just people with heart issues.
Yeah. You got like congestive heart failure. Okay, maybe not.
Doc, you're a wonderful doctor. We appreciate your time. This is not going to be your last time here, but do tell everyone how to get a hold of you, where you're located, your phone number, website, all the things.
Definitely. So we're down in the south end of Tempe on the northwest corner of Elliott and Rural, right? If you've ever gone to the Crepe Bar right next door to me, they're
it's so good.
They're known for their stuff. And so, my phone number is 480-831-2870. And I have a massage therapist, Riley, that works there. She will take your call and get you guys in. And if you got something that I can help you with, I'd love to help.
There you go. Well, see you next time at Connect with Christina. Goodbye.